Hi,
Hi, we're Oscar,
we are Oscar.
a new kind of health insurer.
We didn't create Oscar because we liked health insurance.
We didn't create Oscar because we liked health insurance.
It's quite the opposite.
Oscar is the first health insurance company built around a full-stack technology platform and a relentless focus on serving our members. Our ambition as a company since inception was to build our own technology, not just to provide a superior consumer experience to our members, but also to lay the foundation for Oscar to grow and participate in the healthcare system in other forms. When it came time to start our business, we wanted to let our members know that we were not a faceless health insurer whose logo lives on the cards in their wallets.
We wanted to communicate that we could help them navigate the healthcare landscape like a doctor in the family would.
So we chose a real name of somebody whose life story inspires us to say that we intend to serve them like a real-life person and not a disembodied corporation.
The name of the company is extremely personal to me. The company was actually named after my great-grandfather. His given name was not Oscar, but that's the name that he got at Ellis Island, and he decided to stick with it.
I was born in a small German town where the hometown doctor began his day in the clinic, Dr. Riechmann, and every afternoon hopped on his bike to see patients. I realized how unusual that experience was when I moved to the US.
That wasn't due to the lack of dedication from any of the providers in this system. It was more driven by the fact that there was this fee-for-service system that just produces much worse outcomes than other countries at much higher costs. Health insurance is one of the most important relationships that any American has, both from a human and financial perspective.
And yet health insurance companies are just profoundly disliked by consumers.
Mario and I got together and dreamt of how we could take this important relationship and make it simple and transparent and relatable through technology, data, and design. We set out to create the insurance company that we would want for ourselves. There had historically been limited innovation in the health insurance industry, mainly because the barriers to entry had been way too high. At this exact moment, the Affordable Care Act was being introduced, which would significantly expand the individual insurance market. The ACA provided an opportunity for Oscar to disrupt healthcare at a time when the market was shifting from B2B to B2C. The decisions about health insurance were moving from an HR department directly to consumers who'd be making decisions for themselves. Now was a unique moment to create a company that was relentlessly focused on serving its members. We had to disrupt one of the largest industries in our economy. The US healthcare market generated an estimated $4 trillion in annual spend in 2020, roughly 18% of GDP, of which health insurance dispersed nearly 75% of that. Within insurance, we wanted to start in the most consumer-oriented market, and one that was in the process of transformation. We had always believed that launching in the individual market first would enable us to build the best possible product for consumers that we could easily transplant to other insurance markets over time. Since launch, we have expanded into other consumer-focused insurance markets, including small group, where we sell to the business owner who is making a benefits decision on behalf of her employees, and to the fast-growing Medicare Advantage market, where seniors are looking for an insurer that they can trust with their healthcare well into their old age. Combined, our three markets represent an estimated $450 billion in direct policy premiums. This year, we are offering plans in 291 counties across 18 states. Our ambition is to continue to capitalize on the technology and platform that we have built to grow into many more geographies and insurance products over the coming years. We have built a disruptive model that enables industry-leading trust, engagement, and customer satisfaction in a $4 trillion market. Our results suggest that the model is working. We have strong results across our most important financial, engagement, and affordability metrics. We have grown to approximately 529,000 members, representing a compound annual growth rate of approximately 59% since 2017. Much of our growth has come due to the fact that our members love Oscar. 75% of subscribing members with a medical visit use Oscar tools to search for a provider. The average Net Promoter Score for an Oscar member is 30, compared to 3 for other health insurance companies. We have also shown that our members now have the relationship with their insurance company that we envisioned when we founded the company. 89% of our subscribing members have interacted with us digitally, and 47% are monthly active users trusting Oscar to help them navigate their healthcare journeys and ensure they receive the best necessary care. 68% of surveyed members trust Oscar to advise them on how and where to get the healthcare that they need. What excites us most, though, is the foundation that we've created that enables us to continue to build on our success.
We all know the healthcare system is huge and in need of serious improvements. It's also the only place where you can get incredibly high-tech healthcare, but it's got to get authorized via a fax machine. There are great companies out there applying technology to a single problem in healthcare, like virtual care. But the limits of a point solution is that you can't solve the underlying issues of high costs and lack of coordination in US healthcare. Health insurers, on the other hand, deal with almost every part of healthcare, meaning that unlike the rest of the system, they have the incentive to reduce total cost of care. The problem for incumbent health insurers is that they often rely on legacy technology systems that make it difficult for them to connect the dots to actually shape behavior. And that's why at Oscar we combine the power of being an insurance company with the power of being a technology company. The reason we can solve some of these thorny challenges in healthcare is because we are both a technology company and an insurance company. Combining these two together enables our member engagement engine and lets us make interventions like this at scale. Our member engagement engine fuels our growth in our interactions, while at the same time helping us lower costs for our members, for us, and for the healthcare system at large. While many people don't know who their health insurance company even is, we start by actively and proactively building trust and engagements. We reach out to our members starting on day one with personal messages and welcome kits. Our members are encouraged to download our mobile app, where they can find and book appointments, access virtual care, arrange prescription delivery, and many more features. Our technology architecture takes advantage of multiple non-traditional types of data that many other insurers wouldn't have at their disposal, allowing us to create a much richer, longitudinal picture of the patient's health and life situation. For example, our telemedicine interactions allow us to further fill in the picture with rich provider data on a patient's conditions and treatments. But we go even further, for example, capturing the interactions that members of Oscar are having with their care teams and with our technology platform in real time while they are happening. For example, every search members do filter into our clinical alerts platform and into our algorithms to determine if an immediate outreach is necessary or if they should be included in future campaigns. Oscar's machine learning can identify if our members might be headed to the ER and let us remind them about virtual urgent care as an option. The integration of our data streams allows our care teams to react to identified signals, to prevent unnecessary care, to close care gaps and enroll members in programs to better manage their health. Now, it's important to note that many of these non-traditional sources of data allow us to respond in real time to address problems as they arise, rather than wait months for a claimed process. We also route and even deliver care. Our members speak to virtual doctors who are part of Oscar Medical Group. These doctors can access our members' full patient history, including medical information like, for example, if they have asthma and need to refill their inhaler. Our providers can then work with our members to help route them to the right side of care, whether that's continued in a virtual setting or if they need to see somebody in person. Because all this data lives in our full-stack technology platform, we're even able to offer personalized incentives and benefit designs to members aimed at closing care gaps, promoting treatment plan adherence. The fact that, for example, an inhaler can be delivered to a member's doorstep for no additional charge also helps make sure a member doesn't make an avoidable ER visit down the road. What makes us different than any other insurance company is that we've built our entire technology infrastructure from the ground up. We built a full-stack technology platform that is fully scalable, built in-house using the latest technology, so we don't have to spend a big part of our time or of our capital servicing legacy systems. When we choose to build software, we do so for 3 reasons: to deliver differentiation to our members, to be faster at building and experimenting with innovative features, and to drive the efficiency of our internal operations. We've also built our core systems to be configurable in real time, and that lets us deliver features like dynamic incentives or benefit designs or cost estimates on demand. And they allow us to deliver great experiences while at the same time reducing the medical loss ratio. We apply this same technology to our network configuration approach. We have created our own physician and hospital networks from scratch, directly with the help of our technology and data assets. The tools we built allow us to create hospital and physician networks that deliver the best care at the best value for our members. So how do we do that? We use internal and external data to assemble a universe of potential physicians that we could contract with, and we score every physician and every physician group in the markets on their costs and their quality, and the incremental value that they bring relative to the physicians we already have in our networks. The output of this whole system is a selective network that is custom built for our strategy in a given market, as well as a network that we can continually evolve and improve on over time. Our expansion is driven in no small part by multi-year relationships with 9 of the 10 largest health systems in the United States, including HCA, AdventHealth, Trinity, and Tenet, as well as many distinguished regional healthcare systems. We believe our partners see how this model of Oscar creates value for their patients and for them, which in turn has allowed us to negotiate and realize improved unit costs over time. This has also attracted some of the most prestigious names in the US healthcare system as partners of Oscar, including the Cleveland Clinic and Cigna, who have recognized the power of our end-to-end platform by partnering with us to deliver differentiation in their health insurance offerings in their markets. By thinking like a technology company and using the tools of an insurance company, we aim to improve the functioning of the healthcare markets.